These are some tests that we're going to do for anterior and posterior cruciate ligament. We're going to start with the lateral pivot shift test. We're going to have our patient's knee up here. We're going to have it bent, just a little bit, maybe about just a very few degrees. Then we're going to add some internal rotation to the tibia. And if we have a tear of our anterior cruciate ligament, I'm going to apply this pressure right through here. And this will cause the tibia to actually slide out of place or subluxate. Next thing I'm going to then do is I'm going to pull just like this, that's all. I'm just going to bend the knee. And it has to do with the influence of the IT band on the tibia. When it's up here, and I'm adding this stress, the IT band is pulling the tibia in another direction. When I do this and bend it, the IT band now pulls the tibia back into its normal position, and you'll get this clunk. So it goes from a subluxated to a non-subluxated position. If you're clunking back and forth like this every time you move it, that's an indicator of an anterior cruciate ligament problem. A couple other tests that we have for the anterior cruciate ligament test, we have the drawer test. Now the drawer test, we're going to have an anterior and a posterior, so we're going to be looking for anterior and posterior cruciate ligament. So what we're going to do is we're going to just come over and stabilize our patient's foot, and I'm going to grab just proximal to the calf. You don't want to put any pressure on the patient's calf. I'm going to put my thumbs right here along this tibial plateau, and what I'm going to do is a nice steady draw. And as I'm pulling this forward, we're going to look for laxity in this anterior cruciate ligament as the tibial, if it translates forward, it might come up to 6 millimeters or more. And if it does, then you're going to have a tear in the anterior cruciate ligament. If you're just looking at your patient's knee like this and it's sagging backwards, that's what we'll call it, a sag sign. And that means the posterior cruciate ligament's gone. If it's not quite sagging, but it's you think still that posterior cruciate ligament, you can add an A-P force in there and see if that lets loose to see how bad that posterior cruciate ligament is. Another test is Lotman's test, and so we're going to bring the patient's leg down to about 30 degrees of flexion. And you can stabilize the foot and just pull it forward like this. What this does is it releases the quads so that the muscles aren't helping to stabilize the knee. Other people do it like this. They grab a hold this way, and they basically just shift it back and forth like a little piston going like this. So you're pulling the tibia forward and pushing the femur back, and you're looking, again, for laxity and excessive movement in that joint. The last test we're going to do is Slocum's, and we're going to, again, bend the knee up like this. We're going to then put in medial tibial rotation, and we're going to pull this forward again. Now, what we're looking for is, again, the translation, and there's a wide variety of ligaments that are stabilized here and that are actually being challenged when we're doing this. If everything slides forward, we call that anterior lateral rotational instability. That's the problem. And a couple of things to get involved with this. You can have a little bit of the posterior cruciate, a little bit of the anterior cruciate. The IT band gets involved. The lateral collateral ligament gets involved. We can also turn it this way. So we have external tibial rotation, and we're going to pull forward. Now, the only thing I want you to tell me on the test is this person, if this translates forward, that they have anterior medial rotational instability. That's the answer. But again, you have more of the anterior cruciate ligament, the medial collateral ligaments, and there's other ligaments that get involved with this. So you're just going to pull forward, and that's what we're looking for on those tests.